Hello, my name is Dr. Mike Lampe, and let me share with you how we can help you with your sciatica. Now, there are three different things that we're going to be doing. We're going to help you get out of pain, help that pain that's going down your leg and the numbness and burning to go away quickly. We're going to help you with muscle spasms, and we're going to help you with the restricted motion, the range of motion. There's three things that this is going to help you with your lifestyle as well. We're going to help you get back to work. We're going to help you sleep at night without being woken up by the pain traveling down your leg. And we're going to help you be able to do things on a daily basis with your daily living, such as putting on your shoe, being able to bend over, to shower, to stand even straight. Let me tell you about a patient that we have named Al. Al's retired. Al couldn't work in his yard. He loved working in his yard. He couldn't work in his yard anymore. Al couldn't get out of bed. He couldn't walk without pain. He was almost having to be in a wheelchair. What we did with Al is he came into our office. We took a look to see exactly what was going on with Al, why his spine wasn't sitting the way that it should, and why he was having all this pain going down his right leg. What we did is we found that his spine was shifted out of its normal alignment. So what we did was we started to get his spine moving back into its normal alignment. We started to get his pelvis back into its normal alignment so that it took pressure off of his sciatic nerve so that his pain started going away. The numbness, the burning started going away. He actually started working out in his yard again. He was able to bend over. He is able to sleep at night. And now he can do anything that he used to do, he said, even 15 years ago. The way that we do that, there are three different ways that we're going to help you. One is chiropractic adjustments. What we're going to do is we're going to find out where your spine is. We're going to find out where your pelvis is, your hips. Because what happens is when your spine shifts out of its normal alignment, it puts pressure on those nerves, and especially that sciatic nerve. What we do is we start to gently bring your pelvis back into its normal alignment. We start to gently bring your spine back into its normal alignment, taking pressure off of your sciatic nerve so that your pain, your numbness, your weakness goes away, so that your muscle spasms go away, so that your restricted motion goes away, so that you can go back to work without any pain, so that you can sleep without any pain, so that you can do things around the house like pulling up your shoes and taking a shower. You can do all of these without pain. Number two, we do a specific type of massage therapy called trigger point therapy. What we do is we find out where the pain and where the muscles are and where the muscle spasms are, and we start to massage that area so that your pain and your muscle spasms will start to go away. Number three, we do a thing called active motion therapy. Now, motion therapy is a neurological stretching, and it does two things. It decreases your pain, and it increases your range of motion. Now, there are three reasons why patients pick us. Number one is experience. I've been practicing for well over 12 years. I've seen over 6,000 new patients during that time, and I've helped over 20,000 with chiropractic treatments during that time as well. Number two, we provide internships for young doctors out of school, and we teach them proper case management. And number three, we're part of the Wellness Advisory Council, which is part of the Olympics. We actually went over to London, England for the 2012 Olympics. We took care of USA Judo, USA Weightlifting, and USA Wrestling. I actually went to Medellin, Colombia to take care of our USA wrestlers in the Pan American Games. And the same type of care that we give our Olympic athletes is the same type of care that we give you in our office. What I'm going to do is I'm going to give you an offer. Now, truthfully, the reason I'm doing this offer is because a lot of you have never been to a chiropractor, and I want to bring down any type of barriers that you may have. So this offer includes range of motion testing. What that does is we want to see where the range of motion is in your spine, in your hips. That is normally $30. It includes testing your muscles. We need to know which muscles are weak, which muscles are okay. That test is normally $40. We're going to test your nerves. We want to see how bad that sciatic nerve is. That's normally $40. It includes orthopedic tests. An orthopedic test tells exactly where the joint restrictions are. It tells us how your muscles and your ligaments and your tendons are really functioning. That test is normally $80. Now we're also going to include 4 digital high frequency x-rays. That is normally $160. If we find that we can help you, as an added bonus, I'm also going to include your first chiropractic treatment. That is normally $50. For a grand total of all of these at $400. What we are going to do is I'm going to give you all of that. Instead of for $400, we're going to do it for $97. Let me say that again. Instead of $400, we're going to be doing that for $97. And once again, the reason we're doing this is to bring down any barriers, because a lot of you have never been to a chiropractor. You don't know what a chiropractor is. Also, I feel so confident in this and in what we do that we're going to actually give you 100% money back guarantee if you're not satisfied for whatever reason within 3 days. An added bonus that we're also going to do is we're going to give you a bottle of BioFreeze for the first 20 callers. We're going to give you a bottle of BioFreeze. BioFreeze has 9 active ingredients. What BioFreeze does is it actually will help with your muscle spasms, and it'll help with your pain and help bring that down. So call us today. Our phone number is 727-791-9355. We look forward to helping you.